We are people advocating cannabis education here at paceradio.net.
The views expressed by the individuals during this broadcast are their own opinions, and they may not be the same as those of their group or other organizations they may be involved with.
On the review of Canada's cannabis legislation. With us today in person is the Honourable Yves Duclos, Minister of Health, the Honourable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health, Mr. Maurice Rosenberg, and Nathaniel Erskine-Smith, MP for Beaches East York, and also MC of this event. We'll take some remarks from our guests here today, and then we will go to questions.
Well, thanks very much, everyone, for joining. So I'm Nader Erskine-Smith. I'm the Member of Parliament for Beaches East York. I also happen to be, from a parliamentary perspective, co-chair of our All-Party Cannabis Caucus alongside Don Davies from the NDP and Scott Reid from the Conservative Party. I first just want to note that we are on the traditional unceded lands of the Algonquin Anishinaabe. And I also want to say, from a parliamentary perspective, just how important it is to see the government moving forward on this file as they are, because we have been, in many ways, as Canadians, world leaders in advancing sensible drug policy, and the legalization regulation of cannabis is an example of that. But we didn't get it perfect. We didn't get it exactly right the first time. And this is an opportunity to make sure we are getting it right going forward. And it's great to be joined here by Minister Bennett, Minister Duclos, and Mr. Rosenberg. We also have in the audience folks from Health Canada, the Association Québécoise de l'Industrie de Cannabis, the Canadian Chamber of Commerce, Cannabis Council, Canadian Medical Cannabis Council, and the Canadian Women in Cannabis, and all providing really important perspectives on what should come next. And that question of what should come next, there's a very narrow scope that is in the legislation that would be considered, speaking specifically to the impact of cannabis on youth and on Indigenous communities. And it's very important from a parliamentary perspective to say this ambit should be wider. We should have a much wider scope of the review to ensure that we get this right. And from a parliamentary perspective, I would say we were very committed to advancing three objectives. One was in relation to ensuring that we were better addressing the illicit marketplace and empowering industry to tackle and undercut the illicit marketplace, and to address any regulatory burdens on industry burdens that are getting in the way of what ultimately is the goal, to displace the illicit market. Two, to ensure that we are empowering industry to deliver for patients, and that we are removing obstacles to patient access, and we're allowing for fair patient access in relation to medical cannabis. And lastly, to address the past criminalization and the harms and injustice of past criminalization. And you can think of this in a number of different ways, but other jurisdictions around the world, including south of the border, are better enabling individuals who have been criminalized in the past to participate in the legal cannabis marketplace. And so those were the three general ideas that we had in mind, and I would say, and I'll turn this over to my colleagues here who are advancing the review, because, and I think credibly, the government has listened and they're doing their best to get this right. And with that, I'll pass this over.
Merci beaucoup, Nate. Bonjour tout le monde. Good morning, everyone. We are indeed gathered here on the traditional territory of the Algonquin Anishinaabe people. And I would like first to thank my colleague, Minister Bennett, for being such an outstanding colleague, as well as Mr. Maurice Rosenberg, and all the ones that we have the pleasure of being with us this morning, including representatives from Patient Access, the Canadian Chamber of Commerce, the Cannabis Council of Canada, l'Association Québécoise de l'Industrie du Cannabis, Canadian Women in Cannabis, and all of these leaders and actors and many others have worked very hard to make it possible for us to be gathered today to make this important announcement. As you are aware, in October 2018, the Cannabis Act came into force. The objectives of the Cannabis Act were twofold. First, it aimed to protect the health and safety of Canadians. Second, it provided for the establishment of a diverse and competitive legal industry made up of small and larger players to displace the illicit market. This balanced approach, with a focus on protecting public health and safety, guided the implementation of the Act. Nous sommes très encouragés et je pense que je parle au nom de plusieurs dans cette salle et ailleurs, dans les progrès significatifs qui ont été faits depuis l'adoption de la loi. Ainsi, il y a maintenant une industrie légale en place pour fournir aux Canadiens une gamme variée de produits de qualité contrôlée. On compte maintenant près de 900 titulaires de licences commerciales dans 10 provinces et 2 territoires. Par ailleurs, les Canadiennes et les Canadiens achètent de plus en plus leur cannabis auprès de sources légales et réglementées. Selon les récentes données de Statistique Canada, la part légale du cannabis au pays consommé a augmenté de façon constante pour atteindre 69% au deuxième trimestre de 2022 contre seulement 9% avant la légalisation. À des organisations de tout le pays pour aider tous et toutes à faire des choix éclairés sur la consommation du cannabis. Grâce à des outils comme le Guide canadien de consommation à moindre risque du cannabis, les gens peuvent aussi mieux comprendre et réduire les risques de la consommation du cannabis pour la santé. Ce sont évidemment des avancées très positives, mais nous devons continuer à progresser. Since the start, parliamentarians have recognized the need for an early assessment of the government's new approach to cannabis control and included in the law a provision requiring a review. This is what is bringing us together today. The review will help ensure that the Act adapts to the current situation and continues to meet Canadians' needs and expectations. Aujourd'hui, j'ai le plaisir, avec ma collègue, la ministre Bennett, d'annoncer qu'un groupe d'experts indépendants dirigera cette révision législative. With that, I'm pleased to introduce Mr. Morris Rosenberg, who will serve as the chair of the expert panel. Mr. Rosenberg has had a very distinguished career in the public service, serving as the Deputy Minister of the Departments of Justice, Health, and Global Affairs. He also brings to the table an informed understanding of the important relationship between the Government of Canada and Indigenous peoples. Mr. Rosenberg will be supported by 4 other panelists with broad expertise in the field of public health and public safety. These individuals will be named and announced shortly once the appointment process is complete. Le groupe d'experts fournira des conseils indépendants et spécialisés aux 2 ministres, Mme Bennett et moi-même, sur les progrès réalisés en vue d'atteindre les objectifs de la loi et aidera à identifier les domaines prioritaires pour améliorer le fonctionnement de la législation. La loi stipule que l'examen doit porter en particulier sur la santé et les habitudes de consommation de cannabis des jeunes, l'impact du cannabis sur les personnes et les communautés autochtones et l'impact de la culture de plants de cannabis dans un contexte de production à domicile. The panel will actually broaden that focus to include economic, social, and environmental impacts of the Act, the progress towards providing adults with access to strictly regulated, lower-risk legal cannabis products, C, progress made in deterring criminal activity and displacing the illegal, illicit cannabis market, and the impact of legalization and regulation on access to cannabis for medical purposes. It will also consider impacts on Indigenous peoples, racialized communities, and women who might be at greater risk of harm or face greater barriers to participation in the legal industry based on identity or socio-economic factors. Le groupe d'experts consultera le public des autres niveaux de gouvernement, des groupes d'intervenants et des partenaires autochtones, ainsi que des membres de l'industrie du cannabis. De nombreux groupes autochtones s'intéressent aussi à la légalisation et à la réglementation du cannabis et la ministre Bennett et moi-même nous réjouissons de leur participation au processus de consultation. Sur la base de ces consultations et de ces conclusions, le groupe d'experts nous fournira des recommandations fondées sur des preuves, identifiant des pistes d'amélioration du cadre législatif. Les conclusions et les recommandations du groupe seront déposées devant les 2 chambres du Parlement dans un délai de 18 mois. In conclusion, In 2018, our government legalized cannabis to protect the health and safety of Canadians, particularly minors, and to displace the illegal market. In the spirit of continuing the progress that we have seen and made so far, we look forward to receiving the panel's observations and advice, which will help better address the needs of Canadians, those using cannabis recreationally, as well as for medical purposes, while continuing to educate and protect the public on the health impacts of cannabis. Merci, et je vais maintenant passer la parole à la ministre Bennett.
Merci, Jean-Yves. Good morning, and I too am joining you along with my colleagues on the traditional unceded territory of the Algonquin and Anishinaabe people, whose presence here reaches back to time immemorial. Canada's Cannabis Act, which tightly legalized and regulated cannabis, was, as you've heard, a groundbreaking move of our government to better protect Canadians' health and safety. Cela a été fait pour nous assurer que les jeunes n'aient pas accès à celui loin des criminels et des crimes organisés, et pour offrir un approvisionnement sécuritaire et n'est pas contaminé par des produits chimiques dangereux. Nous savions que nous devions protéger dans notre approche du contrôle de cannabis au Canada, ce que le cannabis met le plus à risque. For instance, we knew that young people are at increased risk of experiencing harms from cannabis, such as mental health problems, including dependence and disorders related to anxiety and depression. The public education awareness activities have been and continue to be critical to this effort to increase the knowledge among youth, and I want to thank all the community groups and public health experts who are central to these efforts. Since implementation, our data shows that young people are more aware of the harms of consuming cannabis and that the usage has remained relatively stable since the enforcement of the Act. Well, a lot of progress has been made on the implementation of the Cannabis Act and its dual objectives of protecting public health and maintaining public safety. We need to assess the work that has been done and learn how and where to adjust where needed to meet these goals. L'examen législatif indépendant que nous annonçons aujourd'hui était un engagement que nous avions fait dans la loi sur le cannabis et sera essentiel pour s'assurer que la loi continue de refléter ce qui est le mieux pour la santé et la sécurité de toutes les personnes au Canada. As part of this review process, it is vital that we listen and learn from the public. We are inviting those with lived experience, Indigenous people, provincial and territorial partners, industry, and any Canadian or organization that wants their voice to be heard to share their thoughts. I want to take a moment to thank the Indigenous partners for the very valuable feedback they have already shared with us over the past 3 years. We have published a summary of what we have heard to date and invite further comments through a questionnaire, as well as participating in the extensive engagement the expert panel will undertake with Indigenous partners, which will be critical to the success of this review. Nous restons engagés envers une relation renouvelée avec les peuples autochtones basée sur la reconnaissance des droits, le respect, la vérité, la coopération et le partenariat. The consultation documents are available on the Consulting with Canadians webpage starting today for the next 60 days. We encourage everyone to share their views and opinions. And we particularly want to thank Maurice Rosenberg for agreeing to chair this panel. I very much look forward to the findings and recommendations from the panel. Je vais maintenant passer la parole au président. Merci. Thank you. Miigwech.
We'll hear from Mr. Rosenberg, I think.
Thank you very much. My pleasure to join you here on the traditional unceded territory of the Algonquin and Anishinaabe people. Je suis honoré d'être ici aujourd'hui et d'avoir été choisi par le ministre de la Santé et la ministre de la Santé mentale et des dépendances pour présider le comité d'experts chargé de diriger l'examen législatif de la loi sur le cannabis. When I found out I was going to be doing this, I had an opportunity to look at the report of the panel on a framework for legislation and regulation of cannabis that led to the Cannabis Act, and I was taken by the way in which they framed their work. I think it's relevant to this legislative review, and I'll just quote very briefly from what they said. They said, "We may not anticipate every nuance of future policy. We're aware of the shortcomings in our current knowledge base around cannabis and the effects of cannabis on human health and development. As a result, the recommendations laid out in their report included an appeal for ongoing research and surveillance and the flexibility to adapt and respond to ongoing and emerging policy needs." Je pense que c'est dans cet esprit que le Parlement a inclus une disposition prévoyant un examen de la législation. Je crois que les examens législatifs périodiques sont un instrument important de la politique publique en général, étant donné que le contexte dans lequel toute loi a été adoptée à un moment donné continue d'évoluer. But I think legislative reviews are really important, particularly important in a law which charts a completely new path from the one that preceded it. The Cannabis Act is really a dramatic departure from the prohibition and criminal law approach that was the way we dealt with cannabis for the past 100 years or so. This review can be helpful in examining how successful the legislation and the measures taken to implement it have been in fulfilling its public health and public safety goals and in enabling the establishment of a diverse, competitive cannabis industry. Le cadre de cannabis est complexe. Il a des implications dans plusieurs domaines politiques, y compris la santé publique, la sécurité publique, la compétitivité de l'industrie et la diversité. Pour cette raison, il est impératif que ce travail soit mené de manière robuste, en s'appuyant sur des preuves et en tenant compte des perspectives des divers groupes de Canadiens. Engaging broadly with Canadians and a range of stakeholders to gather their perspectives will be critical in helping to inform the work of the expert panel. In this regard, I wanted to echo the words of Minister Bennett that engaging with Indigenous peoples and communities will be critical to the success of this review. I look forward to working with the panel and to provide an evidence-based advice to ministers to strengthen this particularly important piece of legislation and advance public policy in this area in Canada.
And I guess turn it over to questions.
Very much. Donc, on va passer à la période de questions en commençant par les journalistes dans la salle. On a aussi une longue liste de journalistes sur l'appel Zoom. Donc, je vous avertis d'avance si jamais vous avez des réponses, de peut-être les faire assez courtes là, quand même pour que tout le monde puisse prendre une question. So we're going to go to question period starting by journalists in the room. A reminder for the people on Zoom to use the raise hand function if ever you do have a question, and I will unmute you. Alors, on va commencer avec Kim Vermette de Radio-Canada.
Bonjour à vous tous. En fait, j'aurais une question pour vous, ministre Duclos. J'aimerais vous parler du pont de Québec parce qu'on lisait ce matin que Yvon Charest, qui a été mandaté par Ottawa, s'inquiète d'une démolition potentielle du pont, qui accuse aussi le gouvernement de Québec de bloquer l'entente entre votre gouvernement puis le CN. Vous en pensez quoi de ça?
Bien, comme beaucoup de gens à Québec, je suis ce qui se passe. J'entends dans ma circonscription, j'entends le maire de Québec, des gens qui veulent plus d'informations sur à la fois l'utilité et les coûts du troisième lien. Ce qui est clair, c'est que l'utilité et les coûts de restaurer le pont de Québec sont solides. Alors, l'utilité, c'est 35 000 véhicules par jour et les coûts, c'est quelques millions, entre 3 et 5 millions apparemment, selon M. Charest, par année. Donc, c'est très modeste par rapport à un investissement qui serait nécessaire pour un troisième lien. On a besoin à Québec de notre premier lien, le pont de Québec. L'utilité est évidente et les coûts sont très modestes par rapport à l'autre projet.
On s'approche de la date butoir du 30 septembre pour s'entendre sur les modalités financières pour le renouvellement de l'accord. Est-ce que ça vous inquiète de voir qu'on n'est pas près d'une entente puis qu'on s'approche de la date butoir?
M. Charest l'a dit très clairement, c'est notre négociateur. C'est un négociateur en qui beaucoup de gens dans la circonscription et dans la région de Québec ont confiance. On sait que c'est quelqu'un de solide. Il a toute ma confiance, il a toute notre confiance. Il a dit très clairement, les délais sont courts, il faut travailler pour que ça avance. Ce genre d'entente est fragile il faut arriver à une solution rapidement.
Marina from CBC. Good morning. We know that Canada's cannabis producers are struggling. They say that they're having to throw out more than they're actually able to sell, in part because of limits on how much they can sell domestically, as well as not having access to international markets. So what are you doing to ensure that this industry is viable?
Well, that's as you heard from Mr. Rosenberg and from Nate, and as you would hear if you were to listen to the industry, this is part of the mandate of the panel. So the main focus is the safety and the health of Canadians. This is a priority. Everything else is secondary to securing the health and safety of Canadians. However, as we work with partners, economic partners, we know we can better support and protect the health and safety of Canadians. We've demonstrated that since 2018 by having so many partners engaged with Health Canada and with the government. We are able to achieve now almost 70% of the total consumption of cannabis being accessed through the legal, regulated, and safe cannabis market. And that's because, obviously, of what happened in 28, but more importantly, that's because of the incredible work that the industry and many others have done over the last years.
You mentioned public health. We know that a new study from Sick Kids and the Ottawa Hospital found they're seeing a spike in children being admitted because they've been exposed to cannabis since legalization. So what are you doing to ensure the public safety perspective of this and that we don't see this continuing?
I'll turn in a moment to Minister Bennett, who, as you know, has a long experience in public health and in the safety benefits of focus on public health. So the counterfactual is what would happen, or what would have happened had cannabis not been regulated and legalized. No, it's sometimes difficult to remember what was happening before 2018 and what would have happened since then had we not made that decision together and not seen the significant progress that many have produced over the last 4 years. Caroline?
Yes, I think that we've done well in terms of the public education campaign, but I think since the advent of edibles, that we need to do more, and that I think that families need to ensure that it's in a safe place where children can access it, and I think everybody agrees with that. But I think that having a legal supply is going to, and regulated supply becomes hugely important as we face this toxic drug supply across this country. So I think that we need to do more, but I think that again that this is something that the panel will look to. But I think that we won't be waiting for the panel to be able to help Canadians keep their children safe.
I just add, from a parliamentary perspective, one, criminalization of cannabis came with incredible harms. And so there will always be public health harms to alcohol use, to cannabis use, and to any number of substances that people can consume as responsible adults. And the public health approach has to be about reducing harms and taking a broader look at a public health approach to say, how can we best regulate activities to reduce harms? And I think edibles are a good example of saying, how are we going to have a sensible edible framework that is going to enable Canadians to be responsible adults on the one hand, but also reduce harms for kids. I would also say, in terms of the industry perspective in your first question, it's very important, I think, that the government has taken a broader view of this review for the purposes of displacing the illicit marketplace, which depends on empowering industry in a serious way. But I would also say that in the short term, because this is an 18-month review and action will come after those 18 months as far as the government is concerned. And so in the short term, we do have to be concerned about, from an industry perspective, from a consideration of displacing the illicit marketplace, what does the excise tax look like from a federal perspective? What are barriers that federal regulations, what barriers exist at the federal level that we can remove in a short-term way empower the industry. And we've already embarked upon this. When you look at the silly limits that were initially in place around quantity instead of potency. So when I would go buy my 2.5 milligram beverages, I could only buy 5 at a time. It made no sense at all. And Health Canada went and looked at that and said, this rule doesn't make any sense. Let's change these rules. And so there has to be that same process from a Health Canada perspective and from a government perspective to say, if we care about displacing the illicit marketplace, Mr. Rosenberg has to do his work, and I have great confidence in his work and in the government's response. And I'm very glad to see that that's been incorporated into the scope of the review. But there is an urgency to this as well, and if there are short-term actions we can take, we should take them.
Simon Fillon, TVA.
Sur le champignon mortel qu'on appelle le candidat au risque, ça fait beaucoup jaser aujourd'hui. Je demandais de votre point de vue au fédéral, est-ce que c'est quelque chose qui prend de l'ampleur? Avez-vous des détails au sujet du nombre d'éclosions au Canada actuellement?
Effectivement, c'est quelque chose qui préoccupe beaucoup de gens depuis quelques temps et qui me préoccupe aussi et qui préoccupe la santé publique fédérale. Et j'aurais demandé de nous revenir rapidement avec des données biomédicales et épidémiologiques sur la situation et j'espère pouvoir les communiquer rapidement avec leur aide.
Selon ce que vous en savez?
C'est ce que la santé publique doit valider. Évidemment, les informations sont surtout dans le domaine des provinces et territoires. C'est eux, évidemment, qui contrôlent les informations générées par les opérations, les tests cliniques et les diagnostics du système de santé au Québec et ailleurs. Donc, ça prend un petit peu plus de temps pour la santé fédérale d'avoir accès à ces informations, mais je demandé d'accélérer le rythme d'accès et de partage de ces informations.
Oui, bonjour, Monsieur Duclos. La loi demande un examen dans les 3 ans. Donc, ça voudrait dire qu'il y a environ 1 an de retard pour lancer cet examen-là. Qu'est-ce qui explique ce retard-là?
Merci pour la question. En toute honnêteté, nous aurions voulu lancer la revue au printemps dernier. Mais on a préféré prendre un petit peu plus de temps pour faire les choses correctement. Et il y a 3 façons dont on les fait, je pense, mieux maintenant qu'on les aurait faites à l'époque, au printemps dernier. La première, c'est que nous avons un comité indépendant et solide, indépendant de la fonction publique, un comité donc qui va être plus capable de travailler avec la communauté de leaders et des partenaires solides que nous avons. La deuxième, c'est que le mandat du comité est plus étendu que le mandat qui avait été antérieurement prévu. Si on regarde dans la loi, il y a une définition beaucoup plus stricte de l'obligation du gouvernement de passer à une revue de cette loi. Et la troisième chose, c'est que comme on a un panel qui va être plus diversifié de par sa composition et plus expérimenté et plus indépendant, bien, il va être capable de non seulement de parler du produit et de la protection de la santé et de la sécurité des gens, mais aussi d'autres aspects, comme les aspects économiques, sociaux, même environnementaux, et aussi les aspects d'équité. La loi, même si elle est beaucoup meilleure que ce qu'on avait avant 2018, n'est pas parfaite. Elle peut avoir des impacts plus durs pour certaines populations, donc il est important de considérer cet enjeu. Et aussi la capacité des Canadiens et de l'industrie d'être inclusive dans les bienfaits économiques que cette légalisation peut apporter. Donc l'accès au marché des entrepreneurs, et au marché du cannabis de populations qui sont présentement trop excluses. Et donc comment est-ce qu'on peut, avec le travail du comité, là, remédier à tout ça?
J'aimerais aussi vous entendre sur la culture du cannabis à domicile. Comment ça va faire partie de la révision, puisqu'on sait qu'au fédéral, la loi permet d'avoir jusqu'à 4 plants à la maison. Il y a des provinces, le Québec, le Manitoba, qui ont décidé, eux, d'avoir une loi plus sévère qui interdit d'avoir tout plan à la maison. Est-ce que ça pourrait changer et être resserré au niveau du fédéral?
Effectivement, c'est une des... quand on parlait d'étendue du mandat, ben, ça fait partie d'un des éléments du mandat qui n'était pas considéré au départ. ou qui étaient moins considérés au départ, donc les enjeux de production à la maison. On sait que c'est une compétence partagée avec les provinces et territoires, et M. Rosenberg et le comité vont, de par leur travail, pouvoir à la fois informer le gouvernement canadien sur la façon de continuer de progresser sur cet enjeu et sur d'autres enjeux, mais cette information et ces recommandations vont aussi être utiles, j'en suis certain, pour les provinces et territoires.
We'll go to Brian Passium, National Post.
Hey, good morning, everybody. First question is, as you know, this review is supposed to begin at the third anniversary of legalization, which was a little under a year ago. Why was this review so late in getting started?
I can do that in English this time, since I tried to answer it in French just a moment ago. Well, we would have liked, in all honesty, we would have liked that to be announced spring or early summer 2022. But when we were ready to do that, we triple checked with the partners, public safety, public health, and the industry, and we decided to wait a few more months to make sure until today to make sure we did three things better. First, independence. Second, the scope, and third, the engagement. First, independence of the committee. This is an independent committee, so it has the ability and the capacity and the freedom to do whatever it thinks it should be doing in the context of this important review of the legislation. Second, the scope. If we look at the legislated mandatory scope of the review, is a lot more narrow than what we're announcing today. And I believe, and I hear, and we hear from many experts and leaders and actors in the field, that this is the right thing to do. Looking at the whole set of impacts and connections related to the cannabis law. And third, the fact that we have such a strong mandate, strong panel, that will enable a review that will be a lot more engaged, consultatively, from a consultation perspective, the work will be stronger. They'll be able to listen to and learn from many, many actors, including indigenous communities, Canadians that may have not benefited as much as others from the legalization that took place in 2018. Those Canadians, for all sorts of socioeconomic reasons, that may not have been able to access the entrepreneurship associated to the new industry. So all of these people's input will be better integrated into the work of the panel because of that little step that we wanted to take before we would announce the review.
Just to echo, as someone who was pushing for the review initially to start right at that 3-year mark, I was accommodating considering the pandemic, but I was especially accommodating with the view that getting the scope of the review right was much more important than the timeline. That if we'd followed the legislation to a T, both in relation to the 3-year timeline, but also the considerations that are set out in the legislation, we would have missed a major opportunity to get this right. And yes, it's delayed, but the scope of this review gives us an opportunity now to get it right.
And I guess I would add that as we announced today, the work has been ongoing, both on the scope, as has been said, on the terms of reference, but to have the discussion guide ready and up and running and online today means that the panel will be able to hit the ground running, and as well as a separate discussion guide for Indigenous peoples, First Nations, Inuit, and Métis.
Okay, thank you. My second question, from the outset, the government, even before 2015, your party and now your government has framed legalization as a means to increase safety, squelch out the black market, and keep pot out of kids' hands. In Ontario, it wasn't until last year that legal sales outpaced the black market, and I'm not even sure it's possible to gauge the impact in places like BC, where cannabis is so ingrained into the province's culture. Then you have First Nations, some First Nations reserves, and even the city of Toronto, who even before legalization had waged ultimately fruitless battles to shut down illegal brick-and-mortar cannabis storefronts that continue to this day. How will this review address these shortcomings?
So there is no question that the major focus of legalization regulation has to be displacing the illicit marketplace. And that's been, I think, a core component of my advocacy and a core component of the government's agenda overall. And the only area where I probably add when I hear the government say we want to address the illicit marketplace and we want to protect kids, I would always add we should treat Canadians like responsible adults. Well, we need to give Canadians choice in doing so. And responsible adults without choice are going to seek out cheaper alternatives, and they're going to seek out avenues where there is greater choice. And so right now, there is still a thriving gray market, I would say. You mentioned a couple of places where they exist. There is also a thriving illicit marketplace. We are not going to overnight displace the illicit marketplace, but over time, especially in the course of this review, especially when we remove burdens from industry and we empower the marketplace and empower choice for responsible Canadian adults, we are going to displace the illicit marketplace. It's only a matter of time, and you are going to, over the next 3 years, 5 years, and 10 years, we're going to see those numbers shift, where there will be a smaller gray market, there will be a smaller black market, and the legal marketplace will be where Canadians continue to turn.
We have just a few minutes left. I think we have time for one last question from David George Kosh from Bloomberg.
BNM Bloomberg. Thanks. Can you guys hear me?
Yes, we can.
Okay, great. Thanks. I just want to I think Nate may have mentioned this, but in terms of the scope of this review, addressing some key points that the industry has long sought to see addressed, including excise duties, taxation, potency levels, packaging. Will this review address those specific qualms that the industry has had for quite some time, for several years now?
And the answer is yes. Now, the scope is very broad. All views will be welcome. Mr. Rosenberg will have a difficult task, but as you might have heard, is very well prepared for that. And we can tell you already that the other members of the panel will be equally strong. So yes, that will be part of the discussion that the panel will want to have with Canadians.
And a quick follow-up there. There is changing regulations to cannabis beverage limits, as well as selling CBD products or products containing CBD through over-the-counter or at pharmacies. Do you have an update on when the ministry will formally announce updates to the regulations containing those two specific issues, or will those be addressed in the review as well?
We'll have to come back to that to be very helpful and both helpful and precise. I couldn't tell you by heart what the timeline would be, and so if that's fine, we'll get back to you.
Hope soon is the Hasselbein 5 cans at a time.
Okay, actually, I think we have time to squeeze in one last question from Deepak Anand from Grow Opportunities.
Oh, hi there. Thank you for taking my question. Given the very short time frame of this consultation in that it's ending in November, when can we expect the announcement of who the other 4 members of the expert panel will be, and when can they be announced? And a follow-up on what criteria went into selection of these members. And will industry expect representation on this panel versus just engagement?
On the nomination, it will be announced as quickly as possible. We're almost there, but we wanted to make that done in the appropriate manner. We want Mr. Rosenberg to be fully staffed, if I can use that expression, and therefore the announcement will come quite soon.
Thank you.
Have time to squeeze in the last reporter who has that would be Black Mangat from Politics Today.
Hi, I just had a question about the scope itself. I know that the government's also consulting on a fact tax on Indigenous communities. I don't know whether
sort of in parallel with this overall review. I'm seeing that consultation wraps up in January 15th. Can you speak about if this review will weigh in on that framework at all, or will it be able to make recommendations on that front, or is it just being treated separately here?
Again, I think it will be better if we get back to you directly on the precise dates and details.
Tomorrow, Minister Haiju and I will be hosting a summit on Indigenous mental health, and so I think that we will learn a lot tomorrow, and I think that there obviously is intersection in terms of all of the work that we're doing together, but I think that we will see what comes out of that, and then we will see where we can work together to get some policies in place.
Okay, thank you.
The opinions of the individuals during this broadcast are their own and may not be the opinions of their group or other organizations they may be involved with.
BMA Hydroponics has everything you need to succeed. Visit our hydroponics superstore at 404 Maitland Drive in Belleville, and we'll show you how to grow your own quality cannabis for pennies per gram. We're open Mondays, Tuesdays, Wednesdays, and Saturdays from 10 a.m. to 5 p.m. and Thursdays and Fridays from 10 a.m. to 7 p.m. Call 613-967-9888. BMA Hydroponics. It's worth the drive.
The only way to go.
CP operates a medicinal cannabis signing clinic. If you want to grow your own medicinal cannabis and are located anywhere in Canada, then I'd like to suggest that you give them a call. They can be reached at 1-613-967-9888. That's 1-613-967-9888, and grow on with CP.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
At Legacy 420, we believe in being different.
Experience the difference of quality control.
Our labs provide tested formulations for all of our products.
Experience the difference in trust.
Our customers can trust that we are following up-to-date COVID precautions for their safety.
Experience the difference in accessibility.
We're open 7 days a week. Please visit our website, legacy420.com, or contact us for curbside pickup as well as nationwide mail order shipping.
Legacy 420 values overall wellness.
Come and experience the difference of Legacy 420.
You're listening to the Pace Radio Network here at paceradio.net.